building trust in the digital health age.
Good afternoon, and it's always a pleasure to be back here in my country, Malta, and to see that Malta is hosting this impressive event. And in the next 10 minutes or so, I would like to talk to you about building trust in the digital health age. So it's not news when I say that just to put in the picture that when we talk about WHO, I'm here representing the regional office for Europe, 53 countries from the European region across to Central Asia. And last week, we actually had our annual regional meeting where the Minister of Health of Malta, Honorable Joe Etienne Abela, also participated. Over 900 million population. And of course, it's not news when we say that health systems across the entire European region are facing unprecedented challenges. And I believe the main issue here is that everyone expected health systems to bounce back after the crisis, and they did not. And our diagnosis is that following the COVID pandemic and the polycrisis that we are encountering, there is a lack of trust. There is a loss of trust among the public that feel that health services are not there to meet their needs in an effective, timely manner. And also among the health workforce, who at times feel that they are not able to live up to the expectations that they have signed up to as professionals because they do not have the resources they need and they suffer moral injury. So in a nutshell, what do we face? We face a disconnect between expectations and experience. And this is serious because what happens when people lose trust? When people lose trust, they tend also then to actually destabilize society, country. And most often what happens also is that they exhibit this when they come even then to the polling booth. One of the strongest predictors of a disenchantment also in political systems is the lack of effectiveness of delivery of healthcare. And last week, we launched this framework for resilient and sustainable health systems across the European region, which was unanimously endorsed by the 53 countries with a simple vision statement, which is for everyone to be able to trust that they will receive the right care at the right time, in the right place, from the right person without experiencing financial hardship. A vision that is easy to adhere to, but difficult to implement in practice. So we need our health systems to transform. And during the COVID pandemic, we saw a rapid digital transformation in healthcare. But this pace has not been sustained. And there is a risk that once again, as a healthcare sector, we start lagging behind. And some reasons for this could be as follows. While over 80% of countries across our region do have a digital health strategy in place, barely half, just more than half, have developed policies to address digital health literacy of the health workers and also of the general public. And just a little bit more than half have developed a comprehensive digital inclusion plan. And of course, as a region, we are aging. And this is where the paradox kicks in, that in the health sector, we want our technology to reach practically our major client base, who tend to be older persons. And just because it so happens that the majority, for example, of the health workforce are women, we need to make sure that the digital solutions are also friendly to a cohort of middle-aged women that make up the bulk, for example, of our nursing workforce, but also because of the way disease is spread, we tend to have a concentration of disease in the poorer social economic classes, people who are going to tend to struggle more when it comes to access the technologies. And just to give you a statistic, over 1/3 of women in the age group 65 to 74 possess basic digital skills, and only 1/4 of women across the European region in this age group possess the skills. So how do we want to digitalize and transform our health sector if our client base does not even possess the basic digital skills? And of course, we put in place a roadmap, an action plan to work on issuing guidance and standards, which is very important for the industry, but also to support countries to be able to have this digital transformation of their health systems. Networking and knowledge exchange events such as these are, of course, also important, and we must be scanning the horizon. First and foremost, the pillar is to establish effective governance, and nowhere do we see this as much as we do, for example, when it comes to AI. And here again is where international cooperation is important. We see the European Union, for example, with its GDPR and its AI Act. But when we come to countries themselves, it becomes a little bit trickier, and we find that many countries lack the basic legislation and governance. And then a second area, evaluation guidelines. Whilst we are very good at evaluating the effectiveness of medicines, we are less good when it comes to evaluating the effectiveness of digital technologies and to make it clear to people and professionals that these are safe, they are efficacious, and they deliver results. Another group of stakeholders that we need to do better to impress are those who fund our health sector. And we're again not terribly good at convincing them that if they are going to put money into digital technologies, they are actually going to gain efficiencies and make our health sector expenditure more sustainable in the long run. Of course, the issues of interoperability remain key. And finally, the point about really involving patients, users, in the digital design and development. And over here, our prime users, no doubt, our super users, are the healthcare workforce. And we have a framework for action that works on 5 pillars. But I want to dwell on the pillar of optimizing performance, the interaction basically between the human and the technology. Because sadly, far too often, what we are seeing in many countries is that the professionals themselves resist the digital transformation, resist the introduction and uptake of AI. And sometimes this is due to legitimate concerns. Sometimes it is also due to a lack of knowledge, competence, and confidence. And here we are working on health workforce optimization, the link between the human and the technology, working with member states to ensure that we develop the capacities of clinicians in leadership such that we are not mere passive takers of what the industry supplies, but that we actually shape and actively engage the demand, that we can come up with solutions to improve the efficiency of service provision, and that we can ensure that we better utilize data to monitor. Our plea to the suppliers, of course, is for the responsible and transparent development and use. Patients need to be able to trust how the technology is developed, how their data will be stored. And here as WHO, we are working with industry, bringing industry to the table. We have set up 2 platforms, the Novel Medicines platform and the Strategic Partnership Initiative for Digitalization. Because we understand that we have to bring industry around the table. Industry sometimes is struggling to access the health sector. The health sector is struggling and needs technology and industry, and we can do far better at bridging this interface. Finally, of course, everyone is talking about how, where, when to integrate better artificial intelligence into our healthcare systems. As I always say, this is not an option, it is a must. This is going to revolutionize care. It's going to enable us to develop far better personalized patient care. But we have to do everything that I said earlier. We have to really step up when it comes to the literacy and to the trust. And at the moment, we are actually conducting a survey on artificial intelligence uptake and utilization among member states to be able to understand better where are the gaps, where are the weaknesses, and where WHO can use its convening power to bring member states together. So thank you for giving me this opportunity. You can follow our work on LinkedIn, on our websites, and I think it's going to be an exciting couple of years ahead. And my, again, plea is that our health systems, universal health coverage model in the European region, everywhere, is under strain. Demography does not have to be a destiny. We can work in a way that we don't allow the shortage of health workers to dominate the discourse, but that we work hand in hand with health workers and with patients to transform our health systems together, built on the underlying foundation of trust. And here, the trust with industry is also key. Thank you.